If you want to understand the bottleneck in modern medical training, look at a med student's desk at 2 in the morning. They aren't just dealing with the sheer volume of human biology, they are fighting a war of logistics. A single study session requires bouncing between unorganized WhatsApp chat groups, lugging around heavy analog textbooks, and trying to verify facts in endless YouTube rabbit holes. Students build intense academic momentum, but it rarely lasts. The constant friction of hunting down past questions and organizing scattered PDFs eventually causes that momentum to collapse under pure administrative exhaustion. Medicine is demanding enough on its own. Adding a broken knowledge logistics layer on top of that curriculum creates an unnecessary structural barrier to learning. Outside of medicine, artificial intelligence is solving data logistics seamlessly, processing massive streams of information and calculating instantly. But if a medical student tries to rely on generic, off-the-shelf AI models, they hit a wall. These consumer tools aren't aligned with strict medical curriculums, and they certainly aren't equipped to prepare students for rigorous professional exams like the USMLE or PLAB. There is a massive vacuum in the market. Students lack dedicated, medically trained digital tools built specifically to handle complex clinical data and punishing study schedules. We have the technology to eliminate study friction completely. It simply hasn't been purposefully architected into a cohesive ecosystem for healthcare. Until now. Enter medical world. This isn't a completely untested idea. Back in 2018, it began as a highly active multi-platform social community for medical students. Now it is being completely re-architected into a dedicated web and mobile application. This dashboard shows the new architecture. First, the Learning Hub centralizes notes, and the assessment engine features professional past questions and quizzes. On the right, the community pillar integrates active news feeds, peer discussions, and competitive leaderboards, preserving the highly engaged social networking. By hardwiring study materials, testing, and peer support into one single interface, this design entirely removes the scattered friction of modern medical education. But the fourth pillar is what drives the system forward. A deeply integrated, proprietary AI assistant. This chart shows how the AI functions as a personalized coach. It analyzes a student's performance data, identifies weak spots, and immediately generates a custom quiz targeting exactly where they need to improve. That utility extends directly into the hospital. During clinical rotations, the AI acts as a diagnosis-specific clerking assistant, offering step-by-step guidance on what history-taking questions to ask for specific patient conditions. Here on the pricing page, we see how this ecosystem will scale. It secures the student base with a freemium model, offering basic resources for free, alongside a pro tier. Eventually, the platform expands to support practicing clinicians, and finally, patient-facing health services. It's a living ecosystem engineered to grow alongside the user, from their first day in anatomy class into their daily clinical practice. The stakes here extend far beyond passing exams. Rebuilding medical world is about closing the dangerous gap between what a student memorizes in a textbook and how a doctor applies that knowledge in a real-world clinic. To do this effectively, the rollout is deliberately sequenced. The immediate focus is resolving the intense educational friction in Nigeria, establishing a robust testing ground before scaling the architecture across Africa and into broader global markets. The end goal is a globally sustainable network of medical professionals, unified by shared digital infrastructure. Right now, Medical World is officially in its 2026 platform development phase. The blueprints are finished, but to turn these schematics into a fully functional reality, the project requires immediate human capital. The project is issuing a direct call for technical builders. It needs front-end, back-end, and mobile software engineers to code the core infrastructure. Alongside the engineers, the platform needs creative and domain experts, UI and UX designers to craft an intuitive interface, and medical educators to author and verify the massive authoritative learning library. And finally, there is an open invitation for strategic partners, educational institutions, and tech investors interested in building a more efficient, AI-powered framework for health education. The blueprint for a better learning system is ready. The next step is to join a founding team and build the tools to fix it.